So good afternoon, and we are back. I just love, like I said, all the information from AE Corner. But now we start out with our next fabulous speaker, which is Colette Florido. Colette and I probably met about 10 years ago, actually, at a support group.
That's correct.
Yeah, time flies, doesn't it?
Sure does.
But Colette is the founder and president of CR World, and she's going to speak about today about can cannabis help your loved one. And she, like many of the people that we've had speaking so far today, doesn't just talk the talk, they walk the walk. So welcome, Colette.
Thank you. I appreciate the opportunity to share information. And I'm going to try and share my screen, but I'm not sure how it's looking on your end. So let's just see how we do. 1 second. Do it this way. So can you see my slides with me?
Yes.
Okay, perfect. Okay, so I wanted to share with you my story, the important thing about why this topic is important. As a caregiver for my dad, I was responsible for watching him through his dementia care, like many others have experienced as a caregiver. I had hit my breaking point. I know many others who have gotten to the point where they feel like they're out of answers or that they feel very alone. And that was pretty much my point. At the same time, I was actually giving birth to my second child. And as you can see in the pictures, that was a very difficult time. I talk about being part of the sandwich generation, which means that not only was I caregiving for dad, I was also caregiving for young children. This is a new dynamic and a lot, something that is different from what we saw 20, 30 years ago. So it's important to remember that there are some things happening that we didn't have. At that time, I had done everything Western med said, and I was just really frustrated with his agitation and his aggression. Somebody had suggested looking into CBD at that point to see how that might benefit with my dad. I did research it, and at that point, we tried some products, and what we realized was that I had really been going through losing caregivers weekly because he had been so agitated and so aggressive. What we found was by incorporating CBD into his diet, his agitation and aggression was lessened. I think the important noticeable measurement was that he was sleeping better through the night, which meant that the caregivers could then sleep through the night. That meant that he could get a 24-hour shift caregiver instead of a 12-hour shift caregiver. That's a cost difference of $1,300 less each month just from that particular introduction of a CBD product into his daily diet routine. From there, we realized that, because he was sleeping through the night, the caregivers were calmer. I never flipped another caregiver. I never got that phone call that said they couldn't handle him. With the permission of the doctors, we were able to reduce some of the medications, the pharmaceuticals that were causing some of the behavioral outbursts to begin with. In essence, we know that it is an absolute, it's worth to look into cannabis as a potential option. Now, you heard me talk about CBD. It's important to note that CBD is still coming from the same plant, the cannabis plant. And what we know about it is that cannabis engages the endocannabinoid system, or what we call the ECS. Now, this system is found within the body. We're learning about it. We've had studies from the 1980s on, but you're starting to see more education on this system. And what it does is the endocannabinoid system regulates your body and creates, its number one goal is to create homeostasis in the cells, meaning that if the cell is missing something, maybe an enzyme or a white blood cell, that it signals what it needs. Over time, that signaling system can be blocked, can be not functioning properly. But when it's working properly, those signaling works. It tells the body there's a problem here. I need pain solution. I need enzymes, et cetera, et cetera. So what the cannabis plant does is it supports that endocannabinoid system that's already in the body, already occurs in the body. The endocannabinoid system is already telling us what, telling the cells what it needs. But the cannabis plant, you can hear the word cannabis and endocannab, some of the same cannabinoids that are found in the plant are the same things that our body is already producing and can be supported by having those cannabinoids put back into the body. In fact, one of the best sources you find of cannabinoids come from the breast milk, of where we use those cannabinoids that we already produce, but also get them from a plant. So in essence, by using the cannabis plant in one form and another, you could support your ECS and nourish your ECS. And as we said, it's able to support what the body is already doing. One thing is certain: the plant is the plant, just rose by any other name, right? The idea that there is a plant that has lots of different properties about it and has a lot of different names, but we talk about hemp, and we know that hemp is derived from the cannabis plant. Okay, what's really important about today's conversation is what I want to portray is to understand that using this plant does not give the incapable, unable to make a decisions, psychoactive to the point where you can't function in many cases. Now, that doesn't mean that somebody couldn't use too much of it and feel like that uncomfortable feeling. But what we find are that people that are incorporating cannabis into their diet are now able to maybe get up without as much pain, get in motion to maybe cook their meal, stay standing long enough to finish cooking the meal, have enough energy to digest the food, and then hopefully maybe have enough to be able to go out and get a chore done. So for many people, it is helping to reduce the pain, the inflammation in the body, to help them to move into what they are trying to accomplish. It's the absence of pain that they're experiencing that causes a euphoric effect, not a high. So I really want people to understand that, yes, of course, it can certainly cause that high that we talk about. But for most folks that are using this for medicine, what they're finding is that absence of pain. So let's talk a little bit more about why cannabis. Why is this important? Well, we know that it can help in a variety of ways, from reducing ordinary stress and anxiety, sharpening your mental focus. These are just a few of the examples. There's so many ways people are now incorporating the cannabis plant into their routine. You can see, for instance, some of it is more emotional. Promoting a positive mood, improving your sleep is going to help with repairing your body. And then even things like your digestive system, supporting that appetite and weight control and having a healthy digestive function. So there's lots of great benefits to using the cannabis plant. The important thing to remember, everybody asks the question because, of course, we want to weigh in all of our new supplements the same. We always ask the question, what are the dangers, right? So in this instance, the question is, can somebody overdose from marijuana or cannabis? And the answer to that is that there are no reports of a teen or an adult dying from marijuana alone. Certainly you can over medicate, and that could be an uncomfortable or an unpleasant experience. But for instance, it could cause too much anxiety or paranoia. Those are things that we want to be careful of. That's why I always recommend people go low and go slow. Often you don't even need a lot of the THC that causes the euphoric effects that we're concerned about. So the important thing to note is that if you have a trusted plant and you have something that's been tested, coming from a dispensary, coming from a trusted source, that you have a very low risk with a lot of potential benefits of relief for your person and for yourself. I'm just going to give you a little overview about the plant so that you have a better understanding as a consumer and as a caregiver as to how it can help. The important thing here is that the plant itself, like the rose, has thousands of varietals, thousands of different varietals that will help you to have different effects. And so we categorize the plant in a couple of different ways. First of all, when you go to a dispensary, you'll see that they're labeled by sativa, cannabis sativa, and that they'll also indicate cannabis indica. These two, and we also talk about a hybrid, which is somewhere right in between. We're not going to talk about ruderalis. That is a medical grade, but here in the state of Florida, for instance, you're going to most commonly see that sativa, and you'll see the indica. So here's what we know about this. Once you know that you have the cannabis plant, there is one part of the plant that makes it more energizing. I remind people to arriba sativa. It's a good way to remember the energizing part of it. It's great for helping to focus, to get things accomplished. I kind of think of it as more of my daytime activities to get things done, to get the house clean, to be more creative, etc. CBD is found in all of the different variations, but it's at its highest amount. You'll find it usually in hemp, which is also derived from this sativa plant. So the hemp products that you see that you don't need a medical card for here in Florida come from this sativa. So you have your sativa, again, a little bit more of an energizing. Then you have your indica, which is going to be more of a calming, or indica, which is the way I like to remember it. But it's a way for you to remember that things that have indica tend to be very helpful with pain relief, nauseousness, can help to create a more of an appetite. Sometimes some of the varietals in the indica have the ability to stimulate an appetite, but can be very calming. So just remembering that when you go to look into using cannabis, there's lots of different versions of this. Now, I'm not expecting everybody to come away an expert, but I just want you to get an understanding that the plant is not the same plant. There's lots of different variations, and what works for one person might not be what you need or what your person needs. The other thing I want to mention is that many products that are found today are in the hybrid category, meaning they lean towards indica or they lean towards sativa, but they aren't necessarily, they're right more in the middle. And I think that for a lot of people, it's a great starting point for folks to try out. But it's a more balanced form of the plant and a great starting point for people to see. As I mentioned, the hemp that is used in the UC CBD is legal on a national level, that you can use CBD, hemp-derived CBD. So knowing that this plant, again, is coming from that cannabis sativa, but this particular form has 0.3% THC, that makes it, again, that THC could cause the euphoric effects, or some may say the psychoactive portion of the plant. So anything with CBD may have THC, but not a large amount of it, 0.3% or less. Okay, there's another. So now we've talked about this rose maybe is like a big white pom-pom, and this one is like a smaller pink bud. So you can start to see that the plant, the cannabis plant, grows in different varietals. What also makes up the plant is the cannabinoid profile. So without going into great detail, we talk about CBD, or cannabidiol. That's one of the cannabinoids that's found in the cannabis plant. Another is the delta 8 and the delta 9, the THC that we've been talking about. Those are cannabinoids. They're part of the plant that have different properties. And what I'm showing you now is a wheel, or the Cannabis 101 wheel, that helps you to understand how all of these cannabinoids then create this particular plant's profile. So I'm going to zoom in a little bit. So we can see here in the CBD, these are a few of the effects of incorporating CBD rich, this particular, plant that has a lot of CBD in it. It's antibacterial, it's neuroprotective, for instance, inhibits cancer cell growth. Okay, so you've got some different reasons why you might want a plant that has more CBD in it. And for instance, reducing inflammation is usually at the top of people's lists. And you can see other things like relieving anxiety, helping with even muscle spasms. So you see a lot of different reasons why even reducing your blood sugar levels. So knowing that something is rich in CBD means that you may see those properties happening in the plant as you use that plant. I'm going to scoot back here. You can also see, though, for instance, the delta-9. We talked about the THC. Delta-9 means that you've taken the plant and now you've heated it up and changed it, hence the delta. But you've converted that into the part of the plant that gives the pain relief, the appetite stimulant, the muscle spasms, suppressing the muscle spasms, reducing that vomiting and nausea. For instance, I'm going to scoot over a little bit here. You can see the delta-9 THC-A. A is going to mean that it's the acidic form. This form is usually the raw form before it's been changed. And that particular form aids with sleep, inhibits cancer cell growth, suppresses muscle spasm. I don't expect anybody to become an expert on the wheel or which particular cannabinoid your person or yourself might need, but I want you to be able to at least understand how the plant is made so that you can see how it's used a variety of different types from the dispensary have different properties. Next, I want to talk about one other part of the plant that's already found in nature, and a lot of people already know how these terpenes work, but they play an important part in the therapeutic benefits of the plant. We know that terpenes are found naturally in nature. And for instance, when you walk into a pine forest and you take that fresh breath of air, you know that you're getting clarity, maybe a little calming. You're probably taking in some of the pinene that you might find in the forest. For instance, if you're looking to get a better night's sleep, one might put some lavender on their pillow or might use a lavender lotion of some sort. The lavender or linalool is another terpene that is naturally found. These types of terpenes are found in the cannabis plant and also, again, play their part. So when you have different smells and you have different effects, for instance, if I'm looking for something to energize me, I might find something that has limonene in it, which is that same citrus smell that you smell when you have when you're smelling the fresh lemon zest. And it's, again, invigorating and can help with energizing. So you can start to see how finding the right one can really make an impact on your therapy and what you're trying to accomplish. Again, I don't expect people to be experts. So what I'm sharing with you, is a terpene wheel that on a resource that I'll be happy to share afterwards as well. But this just shows you on the top, the outer ring. This is showing you some of the different varietals of the plant. The 2 letters or 3 letters are almost like their elements chart. So you can recognize a varietal or a strain by the name, but then you can start to see why people are liking that particular varietal of the plant. So for instance, in this case, I'm picking this hybrid here, this one's called Headband. And it has this anti-inflammatory, antibacterial, pain, hops and coriander. So you can find some of the different terpenes in there, helps with the suppresses and helps to suppress the appetite. You'll find that woody and earthy, and it's very rich in humulene. So that's just one of those terpenes that, again, is supporting what the plant is doing in the body. And for instance, this one is your pinene, and that you can find pinene in a few of these other strains. And again, great for inflammation, great for asthma. One of the things that a lot of folks think is that by using cannabis, that it's counterintuitive for somebody with bronchio issues, but in actuality, the pinene is great for asthma and can help as a bronchodilator, can actually open up the airways. Things like the smells that you're getting, the pine needles, the conifers, the sage, can help with that memory retention and alertness. So you'll start to see a lot of the similarities. There's a little crossover, but it helps you to see the benefits. Let's talk a minute for how our cannabis is being used now with elder care. And the first and foremost, I mentioned it with my own story, I believe that it's an important path, is getting a good night's sleep. Getting a good night's sleep and having REM sleep is that difference that your body needs to really start to repair, to let the brain repair, to create new neural pathways to help with the inflammation. So incorporating that into both the caregiver and into the person you're caring for, into that routine, can improve one's sleep. And as I mentioned, the inflammation and the chronic pain, it can be great for palliative care. I have a lot of folks that are using the cannabis plant, whether it's CBD or a dispensary issued product with more THC. They're noticing that they can reduce the need for those pharmaceutical medications, and maybe not have to have so many heavy hitting prescriptions. For depression and anxiety, we know that oftentimes there's grief, a lot of grief, and also even just that feeling of I've been cheated, I'm resentment, all of those feelings that we might feel as a caregiver, or we might feel as the person going through this, coupled with the grief of perhaps seeing others around us pass, or the grief of losing your abilities, can cause that downward of depression and anxiety. So trying to help with the outlook so that we go about our day and get the nutrition, get the help that we need, can really repair the outlook. Nutritional digestive support is another key area. Good, I'll talk about it later, but good gut health equals better mental health. But as a caregiver, it is critical. You need a good night's sleep. You need to be able to care for your other person, or you stand the risk of both of you being unable to do things at your best. So it's really important to support your own digestive system as a caregiver. Skincare is another key element, utilizing it for topical relief, for the things that are coming up, the itchy, dry skin, medications that could cause itchiness, bed sores, things of that nature can be benefited. And just in general, mobility of the joints and muscles. Now, those are thinking that they might be interested in going into medical marijuana side of things and want to go into something beyond what's available at the counter. You can look into your state medical program. Here in Florida, we do have qualifying conditions such as the ones in front of you, most commonly the post-traumatic stress disorder. Many of these, I would say the descriptions that they have here, they always have the or similar. So if by chance pain, sleep, or inflammation are causing you challenges, those are some of the same symptoms of these qualifying conditions and would also qualify you. Most folks will qualify based on their background and history, but then finding the right plant and finding the right routine, therapeutic routine for you would be the next step to find the right one. I also want to mention, because it's important for folks to realize how vital this plant could be in future care, and really thinking about having that conversation with your doctor. You might be aware of this patient, Kathy Jordan. She is a patient here in Florida, and she is the reason that smokable flower is allowed in the state of Florida. Why is that important? Well, it's most important to her because Kathy, was diagnosed with ALS in 1986. Many folks who understand ALS understand that disease is usually a 5-year sentence, roughly, or I shouldn't say sentence, but I should say it is not a long prognosis. Oftentimes within 5 years, most of those folks who have been diagnosed have succumbed to their disease. Kathy is still alive with us today because of her use of cannabis, smokable cannabis. Very important because that is what causes her to dry up, what causes the saliva normally to choke her and cause her to aspirate. So it is important to understand that the plant has many uses, one of which is, in her case, it's helping her to breathe and to stay pain-free, again, trying to reduce the needs for the medications. And as you noticed in what we talked about, a lot of the spasticity and the spasms that occur, she's able to minimize those. But it's important to know that the other forms of delivering this medicine by a tincture or by a vaporized form would not have accomplished what she needed. It's also important to know that she's here with us in 2022. It is absolutely something to have conversations with at this time with your doctor. Now, the question that I always get asked is, are there medication interactions to worry about with medical cannabis? The important things to know, I'm going to try and keep it high level, is that cannabinoids levels can be increased by other medications. So if you're already taking medications, that could heighten the effectiveness of the cannabis, for instance. Inversely, cannabinoids can affect levels of other drugs, making them more effective, making them less effective. So it is a matter of understanding how they do interact with other medications. Smoking marijuana can increase clearance of some drugs, meaning that some drugs will not function in the same manner. Additive effects can occur with each of the other drugs, meaning that there could be additional side effects and other effects because they are now coupled together, or that they could be more potent, for instance, that the medications can be potent. That said, all those things considered, usually people are finding that they can find a way to incorporate medical cannabis or a hemp-derived CBD-rich product into their diet, and that they can find a level that works with their current medications. So knowing that they are not necessarily, they will be able to use it. It's just a matter of understanding how it's going to work with the current regimen of medicine that they have and as they change their medications. There are a few medications, though, that I want to bring to light that's worth noting. These are the red flag indications. Red flag indications, I remember them as the grapefruit test. If the medication says it should not be taken in conjunction with grapefruit, that is usually an indication that it's worth asking the question. For instance, the warfarin increases the international normalized ratio and risk of bleeding. So it's something to be aware of, and especially if they are on these medications. So I'm not going to go through all of the details, but just make a note if your person is using that particular medication to go even lower, to go slower, to speak with a doctor, to have a good routine into introducing the plant into the diet. Let's take for a minute. Let's say we don't want to go the THC route. Okay, we've talked about if you want to get your medical card, you can, and that there are certain diagnoses that qualify you for getting your medical marijuana card. And I have somebody I can recommend, or if that's something that you need. But more importantly, you may not need that just yet. You may be able to start with more on the CBD side, which means you wouldn't need a medical marijuana recommendation from a doctor. You don't have to apply for the state to get your card. But it is important to become an expert, right? As we're experts in our caregiving role, it's important to understand what you're shopping for. So a few basic things I look at when I'm looking at the CBD side. This is probably the one that's going to make more sense now. you see something that says whole plant or full spectrum, or you see that it says broad spectrum, or maybe that it says isolate. What is this telling you? Well, in this case, isolate means that they have just pulled that one cannabinoid out of the plant, CBD, cannabidiol, right? That's the one cannabinoid. And they're just going to give that to you. They have heated it up to the temperature to extract it and now are giving you CBD. That's isolate. Broad spectrum means that they've taken the whole plant and they're going to give you almost all of it, but they're going to take something out. And most likely it's going to be the THC. Okay. And that's also a great choice. I really like when it's a broad spectrum because you're not reducing, you're not you're getting the majority of that plant, but you're still changing it a bit to get to removing the THC from that. But for somebody who might be concerned about drug testing or who might be concerned about, really, it's the drug testing that is the biggest concern. That's a good reason to maybe look at doing something that's isolate or broad spectrum. If you're not concerned about the testing and you're okay with us having all of the plant available to you, I highly recommend a full spectrum. And the reason that I say that is because we know that the plant uses the cannabinoids, that wheel that we looked at, it uses all of those terpenes, and it creates what's called the of course, it's just left my brain. It's creating the entourage effect. And that entourage effect means that they work together synergistically to form what the body is needing, to help unlock that communication for what the body is needing. So in an ideal scenario, that THC is very helpful to bind to the system. And I do prefer full spectrum whole plant. And again, you're also not breaking up the plant. So getting that CBD as well as all the other parts of it that have their benefits and therapeutic effects. I also at least ask the question, where is it grown? Is this in the U.S.? Is this making sure you know where the plant is coming from? More importantly, I want to know what else is being added to this. What is happening inside of the bottle or inside of this packaging? How much? Because oftentimes what I'm finding is that you're getting a very small amount of that CBD, but you're getting a lot of other things in there that you may or may not want. For instance, are they adding sugar or sweeteners that are going to be counterintuitive? If you're trying to reduce your inflammation, you don't want sugar to be your main source. If you're trying to fight cancers, sugar feeds cancers. You certainly don't want to be adding more sugar to your diet. So what else are they adding to that? Are they boosting it? Oftentimes, if a label says it has natural terpenes or natural cannabinoids, I didn't have to list it as an ingredient if I already said it was whole plant hemp. If I have to list it, it means I've probably added them to it. So I'm now bulking the plant up. So it's just important to know that might be exactly what you need, are more of those terpenes or those cannabinoids that they have in there. But it's important to know what other flavorings or additives are going into your brand. The other thing is, what is it being delivered in? What's the carrier oil? It's just helpful for you to understand. Is it MCT, which is medium chain triglycerides, which is coconut oil that's been filtered to only have the medium chain triglycerides? Again, just like whole plant versus broad spectrum, we're kind of doing the same thing now with the oil that you're getting, the MCT oil, because it'll always be liquid because we've taken out all the fats. But we kind of like the fats in some cases because it does help to deliver into the body. So, finding something that's a full unrefined coconut oil or olive oil or hemp seed oil or avocado oil, those might be a great way to deliver. So I like those types. MCT does also work. It's great for being stable. And if somebody's allergic to certain ingredients, you also want to be paying attention to those carrier oils. The other thing I ask is, how much CBD am I getting per serving? And remembering if I'm getting isolated CBD versus if I'm getting whole plant, because I may not need quite as much CBD if I'm getting the whole plant, because I'm going to get other parts of the plant that we're not even measuring or talking about, but they're going to have therapeutic benefits. When you look at something that's more isolated, you're only getting that CBD, you're only getting that one cannabinoid. And so most likely you're going to get a lot of it. So the important thing is, just because the bottle says it has thousands of milligrams of CBD does not mean that that's the highest potency or the best quality. It does, however, mean that you're going to get a lot of that CBD in there. You might need that high potency, but you might also benefit from having more of the whole plant. I'm just going to mention the extraction process so that you understand how this plant comes to be from a plant form to what we take in usually as a tincture. The plant can either be cleaned by being cleaned in an alcohol, or it can come grown naturally and not have anything done to it. The other part is that how it's extracted. Oftentimes you find a lot of people use what's called the CO2 extraction, where they're breaking off the parts of the plant and using that like a high pressure and low temperature, and they're breaking off the using CO2. Other instances, they heat it up. So you'll extract it by different temperatures. I like the ones that are not using any solvents. And forgive me, there's solventless and then there's solvent free. And I don't want to confuse it, because one of those means that there's no solvents involved, and one means that they've removed them again. So if you're looking for that natural approach, looking for something that has not used solvents, for instance, a lipid extraction where there's no pressures and temperatures, it's almost like when you steep your tea, you're putting the plant into the carrier oil and you're getting that plant out. I want to touch on these different methods, because a lot of people realize that, okay, I want to start doing this for mom or dad or for my partner, but I don't really feel comfortable handing mom a joint, right? Well, the reality is that you may not need to, because there's lots of different ways that somebody might be able to deliver cannabis to the patient. Topical is the easiest way for people to experience the relief without any concerns of the psychoactive or those euphoric effects, because realistically, it's getting more of the pain receptors, but it's not necessarily causing, again, that it's not crossing the blood-brain barrier like inhaling it or ingesting it would. So you also have the option then for inhalation. And then we have oral, and I'm going to talk about the differences with that and even ingesting it. And finally, suppository. Okay. We're going to just take a few minutes here. Why is this important? Because each one of these delivery methods has a faster or a slower onset, how long it takes from the time you put it on or ingest it, and how long that lasts. That is important for your long-term financial picture as much as it is about how it's helping you. So topical relief, you can see the different varieties of ways you can go about it. Usually it's a very fast onset and averaging about 4 hours, 1 to 4 hours of effects. We do know that there are transdermal patches that can be worn for 3 days at a time, and those can be very beneficial as well. And that is going to get more into the bloodstream for its use. Now, inhalation, these are going to be absorbed directly into the bloodstream through the lungs. You can combust it by smoking it. That's where people are smoking their joints, or they're smoking the flower. Or you can vaporize it, where you're heating it up, but you're steaming it. You're not actually combusting it. And it's the fastest of the onsets, between 0 and 15 minutes. So I like to look at that as my acute, something has come on quickly and I need something to address it. That's where the vaporizing it or smoking it would be a good approach. And the lasting effects are much shorter. So, not something that you would want to be doing every hour. You want to look for something more long-term. Okay. And what's also important to note is with caregiving, it's good to know there are options where there's metered doses that you can use. There's inhalers being utilized at some of the dispensaries, non-flammable options. So there's safe ways for people to deliver their medicine. Now, I'm going to only touch on concentrates, and here's why. It's like a catch-all, and there's lots of different versions of concentrates that you will see. And I'm just going to scroll on through here. We've known from the earliest days of hashish, which is using the plant in drying the plant down and then sifting some of the particles and your hash oils and things like these very concentrated forms. And they're not for somebody who's just starting the process. I don't usually recommend these for anybody until they've had a chance to see how their body responds to something with a heavier amount of CBD, and then some of the other delivery methods other than concentrates for the THC. The other form of delivery here, you have an oral. Now the oral is going to be an under the tongue, sublingual, on the tongue, or something within the mouth. So that's going to be your tinctures, your oral sprays, capsules, lozenges, something that dissolves. Usually it's going to take at least an hour for them to then make their way through the bloodstream, but longer lasting effects, so 1 to 2 hours of effect. Ingestible products, again, just remembering that they will last longer and they can be much stronger, and they can cause more of the psychoactive effects with the THC than some of the other delivery methods. This is one that you are committing to about a 3 to 4 hour window when this type of ingestion. In this case, you're passing through the gastrointestinal tract and then passing through the liver before entering into the bloodstream. But at that point, first now, cannabinoids pass through the brain more effectively this way, but it does create that increased potency. So it's something to keep in mind. But it also is to be a way that you'll get more of the whole body delivery. So now, as far as how that ingestion can happen, it can be in foods, it can be in beverages. We know candy to be the most common way people take that. For instance, the gummies or even the brownies. They can have oil by itself, or again, that oil could be a food ingredient, but also in the raw plant. We do have some folks that will use the raw plant and juice it, for instance, if you have access to that. Longer lasting effects, 3 to 5 hours plus, more bioavailable in the body, but definitely takes longer. This is where you hear the stories of folks who maybe took they took it, then they didn't think it was working, and then they took more, and now they're kind of feeling uncomfortable. So I always encourage people, you can always add to it 2 hours later, but you don't want to rush this process, especially the first time people are trying it. But the important thing is go low, start slow, and be prepared that things like CBD or even chewing on a little bit of lemon zest, or in a pinch, you could even chew on peppercorns, although who wants to do that? But that is the best way if you're not comfortable with the effects that are happening from your THC medicine. Again, we're back to what's in it. Well, the black peppercorns have beta-caryophyllene, which is another terpene that will help to minimize those effects. The limonene in the lemon zest that you chew can also help to calm those effects. CBD is the counterpartner for the THC. So if you find something that's heavy on the CBD and just has a little bit of THC, you almost never hear of somebody even really noticing those effects. If anything, they just felt a little calmer, a little bit lighter, a little bit happier. I also want to mention the other method that doesn't get addressed as often, but is a great method for anybody having lower extremity pains, having lower digestive issues, or having trouble with the medicines that they're taking because they're not delivering enough potency. Making a suppository allows you to deliver this in a way that it just bypasses the whole digestive system altogether. You're not losing anything in the acids that you're digesting. And so therefore it will cross the blood-brain barrier a whole lot faster. And it has a much stronger effect and is long lasting. So somebody who's looking for a great deal of relief and doesn't have anywhere to be, suppositories are a great approach. Great for overnight as well. Also helpful to know if you have a lot of other issues, female issues, there's you can deliver those suppositories both rectal and vaginal. So those with pelvic region issues, there's many nerves that travel up to the legs and the spine. And so, this is a great approach to address those, as well as the colon, which has many receptors, which can mediate those effects of the THC. And I will also add on the rectal side, it can activate those local cannabinoid receptors, great for things like hemorrhoids and acute inflammation. So how is cannabis supporting mental health of elders and their caregivers? Again, we talk about how gut health equals mental health. If you can keep your gut health, if you can keep your inflammation down, if you can eat foods that don't cause you the inflammation, your mental health will not suffer. Your body won't be reacting to the inflammation that's happening in the gut and start sending things to try and help it. It can focus its attention on what you're doing. So good gut health is important and crucial for caregivers, and also vital for your the person you're caring for, making sure that they're getting probiotics and foods that are going to support that digestive health. Getting a better, deeper REM sleep is going to give both you and the person you're caring for repair. But the big thing is that calming the anxiety with the CBD, or maybe one of those indica or hybrid cannabis with some THC. And I like the idea of, if a caregiver is on 24/7, how do you shut off for a minute? Well, in this instance, maybe using a little bit of that THC, taking those deep breaths that we're told we need to do, and then going back and doing the reparative work. Maybe it's a 10 minutes of stretching so that you can help that person be more mobile and transfer that. Maybe it's yoga to center yourself. Maybe it's more meditation and breath work because things have been stressful. Maybe it's sound therapy. Maybe it's going to a live concert. Maybe it's that art therapy or dance. But partnering them together, I find, being an A-type personality, helps me to shut that brain down for a minute, and let the creativity flow. Let myself be me instead of having to focus on the person I'm caring for. Sorry, guys. The other question that people ask me, THC versus CBD, which one's going to be better for my senior, my elder? The first thing I have to say, and this goes without saying for all of the parts, I am not a medical professional. I am only another caregiver just like you. And I find that asking your medical marijuana doctor is the best starting point, because they will know specifically what are you trying to accomplish, what symptoms are you addressing, and what is the lifestyle and what will work best into that lifestyle. Meaning things like, well, also what's the personal preference? Would they consider this given today's published knowledge? Would your person look at new treatment options that might give them some relief, some pain relief? Looking at the condition itself. Again, if your medical marijuana doctor, also your other doctors can be very beneficial to talk with. We do know that some of those doctors have not made the crossover, are not recognizing this as part of their traditional practices, and that's okay. But I do encourage folks to be looking at all the options when you're looking for answers and hope. Sometimes you have to look outside of the box and looking to those other doctors who understand your situation, your condition, or your loved one's condition, as well as other things that are going on. Understanding the medication interactions, if they have any of those red flag medications, you might, again, consider staying with more of a CBD-rich product, or maybe looking for something that's similar to that. I always suggest, there we are, try the CBD-rich product first, because you may not need that card. You may not need the high THC. Then if you do decide you want to go to the dispensary, start with a high CBD, low THC, something that doesn't have a lot of THC. And again, you might find exactly what you're looking for. And then the next option might be a 1-to-1 CBD to THC, or something that's meaning that, you know, you might have an equal part of CBD and THC, and then go to the THC. Now, if you're in a tremendous amount of pain and you want to go for the gusto, then I would skip right on ahead and go see your medical marijuana doctor. Now, again, I'm not an expert. I'm only giving you experience from the field, and what I know to be the averages. They ask what's the right dosage to start. CBD, again, after we've just talked about this, now that you're an expert in understanding the CBD and how it's made, you know that this number is only as good as knowing what else is in the jar. So if you have 10 milligrams of isolate, that's very different than 10 milligrams of CBD that's part of whole plant. So 10 to 25 milligrams of CBD, that is, I usually say that's something that's going to be full spectrum. But I do see folks that will start their isolate in that low range of maybe 25 milligrams as well. On the THC side, and this is always dependent on the delivery methods too. If you're going to take a tincture versus a suppository, there are very different delivery methods. So this is the only ballpark. But if you're looking at, for instance, a gummy, or you want to try something, when I say low, you might just take that one gummy, and maybe it's 10 milligrams per gummy. You might take that down into quarters, and then just have a quarter of that one and see how that goes. That'll give you just a little bit less to start. This, for instance, is a link that I like, weedmaps.com. You can learn about how to consume and decide how much to take. So that's just one resource that I like to use. Another question that comes up, very common, how do I start that conversation with the doctor or the family about using medical cannabis for a therapeutic? So I always encourage the person who is interested in learning about it to familiarize themselves, get yourself comfortable with trusted articles and content sites. Ask the questions of, in this case, we're talking to the person, have we considered using cannabis therapeutics for mom or, my husband? Does the person feel it will not work, or is it against it for all patients, or is it specific to the condition? So if somebody were to say, oh, that's a bad idea. Well, can you clarify? Is that because you don't think that it's the best idea for my patient, that you have broad, no on everything, or is it maybe specific to the condition? Because that will at least help you to understand their answer. Clarified, oh yes, this person has knowledge and this is just not the right direction, versus somebody who says, I'm just not interested, and no, this is not going to work. And we have those folks, we have medical professionals that still say that. And then the other thing you might say is, perhaps we could start with some CBD. Maybe you don't have to, again, go with that medical marijuana, but it is something that you want to have the conversations with. It's important to find a team that recognizes that they support it as a therapeutic. Doesn't mean that they have to use it, or that they see that the person has to have THC all the time, but they have to recognize it just like all the other supplements, just like all of the other prescriptions that somebody might have. Advocating on behalf of the person's wishes. The things that I like to say is that this is a natural approach. It is a plant, and the less that they can touch it or mess with it, the better off I'm comfortable. The more comfortable I feel. But it can support Western medicine. But it can be a combination. Okay, this is what Western medicine suggests, but there's got to wrap up here. And then can also strive to minimize the need for those pharmaceuticals supported by a healthy diet and exercise. So again, we're really trying to get that down. Now, I'm just leaving these sites up and I'm going to wrap up here. Yes, ma'am.
I just got one question. Somebody asked, am I allowed to bring this kind of stuff into an assisted living community?
That's a great question. You have to ask the community. Some communities are now being more open to CBD only. Some are open to medical cannabis. Most are open to it, but not dispensing it themselves.
Okay.
But they are what they are looking at is that it's part of their regimen. So you want your doctor's involvement so that they can record it on their charts so that this is part of their nutritional supplements.
Okay, thank you.
Thank you. Good question. And if you have other questions, I am just going to share a few resource tools, but now is a great time if you have a question for me. These are just a few places you can go, the comecrworld.com. That's the site that I founded for caring for my dad. flcan.org is a great Florida state resource. But I think the important thing is that we start to reimagine how we age more naturally. So I want to encourage you to look at cannabis and hemp rather than being a last resort, that it is more of a first line of defense. So I encourage you to have that conversation. And that goes to both your care team and even in advanced directives. So if you yourself have an opinion, be sure to share that. If someone's interested in trying some CBD products, these are the products that I used with my dad. I used the coconut oil, I've used the honey. I like the capsules for an easy delivery method. You're welcome to try those products for yourselves and see if something works for you. Questions?
I don't see any other questions, but tell people about the center for the people that are located in Florida. And I also want, because somebody just had said a little while ago in the chat room, oh, I wish I had those slides to show my family. Well, you do have those slides to show your family, because anyone who has registered for this conference within 4 weeks after the conference will receive 21 videos of the conference. So you'll have all this information to share with your families. Yeah.
Yes, please share it, because this is it's not something that you can take in on one conversation. It's good for you to be able to go back and listen to it. A couple of things. When we talked about caring for the caregiver, the center at St. Pete Beach recognizes that cannabis is part of your wellness. One, they have a doctor's office, Triverde Health. Triverde can get you your medical marijuana card, and they can also get you a caregiver card if you are going to be the person that is transporting your person's medicine. You don't qualify, but it allows you to then transport and pick up the medicine on their behalf. The center also has all sorts of great classes and other things you can experience, like wellness, anything from sound bath therapy to silver stretching to intro to belly dancing. And I think you should try all of them. And if you mention that you heard it here, you can definitely expect that they will give you a discount from Colette from CR World. And last but not least, I should mention I am also teaching the Savvy Caregiver program here in Pinellas County. So for those of you who are caregiving for a senior, if you are 60 years or older and you are caring for a patient with a dementia-related illness, the Savvy Caregiver program is a 6-week evidence-based training and is offered through the Area Agency on Aging Pinellas and Pasco County. It's free to you. It is a game changer to understand how to care for a person with dementia and how to really change your outlook. So you can reach me, my information right here on the screen, and just message if you'd like to learn more about that.
Thanks so much, Colette. I appreciate you being with us today. I think people got a lot of really good information.
And I want to thank you, Linda, for hosting such a great event. I hope you guys weren't watching my head upside down while I was doing that, but good. Well, thank you. I appreciate it. Caregivers, I just want to say you are amazing people. You are being worked hard, but somebody is really appreciative of your care. So don't stop. Don't give up. Thank you for what you do.
Thank you, my friend. Have a delicious day.
You as well. Take care.
Awesome. So I'm so happy that Colette was part of this conference, because I really think this information needs to get out there. There are so many different questions and so many people are hesitant. So I hope that brought some good information to you today.